So my presentation today is an overview of supporting healthy pregnancy through eating well, being active, and managing weight. So the advice is based on the NICE guidelines, which you're all probably extremely familiar with. But the bit, that I've taken today is the key recommendations around vitamin supplementation, which I'm sure you're aware of, folic acid, vitamin D, and then for children under 5. And the section on healthy eating, physical activity, and weight management in pregnancy. So to promote a balanced diet and dispels the myths such as eating for two, tailoring advice to individual needs and cultural context, encouraging physical activity and to reduce sedentary time and behaviour, body mass index measured at booking, and to avoid routine weighing unless it's clinically indicated, to avoid intentional weight loss during pregnancy, and for BMIs over 40 to go to a specialist service, and a BMI over 30 should be tested for gestational diabetes. Then I've put in the guidance here around breastfeeding and formula feeding, just for your reference. Okay, so the first thing I wanted to allude you guys to was hopefully everybody has seen this, but it's a really good resource, which is Every Child Wales, which is the 10 steps to a healthy weight. So this is nationally available. Every health board in Wales and Public Health Wales contributed to this. So a great resource either to give to pregnant ladies or as a prompt to start behaviour change discussions with that person. The benefits of physical activity during pregnancy is extremely well researched. So we know that staying active while somebody is pregnant improves sleep and circulation, helps reduce tiredness, although that sounds counterintuitive, improves muscle tone and strength, cope better with labour and delivery, help with the accuracy of scans and examinations, better health for baby in later life, reduced likelihood of postnatal depression. Eating well can improve anemia and constipation, so often those symptoms that come along with pregnancy, enhancing mood, concentration and well-being, and reduces risk of gestational diabetes and high blood pressure. So in terms of healthy eating in pregnancy, we do still use the good old Eat Well guide. So the benefit here is that it's a balanced diet with no excluded food groups, and discussing the benefits of healthy eating for mum and baby during pregnancy, and also making sure that the mum has plenty of fluids during pregnancy. This is a general resource that we would tend to use with mothers to try and promote eating well. So the classic kind of advice of eating at least 5 portions of fruit and veg every day. We will often advise frozen fruit and vegetables to try and keep cost at a minimum and also to reduce food waste. To base meals on starchy carbohydrates such as potatoes, bread, pasta, rice, and to choose whole grain versions where possible to make sure that the fibre intake and vitamin B intake is as high as we can get it. To have 3 portions of dairy or a dairy alternative, looking at low fat or low sugar options if we need to. And to make sure that a protein is included with each main meal, or each meal actually, so breakfast, lunch, evening meal. Things like beans, pulses, fish, eggs, and other proteins. To choose unsaturated fats, such as cooking oils and spreads. and to reduce or have a moderate intake of foods that are high in fat, salt, and sugar. So those kind of ultra processed foods, because usually they carry a lot of calories with very minimal nutritional value. So this is kind of a resource that we would use to try and describe what a portion of fruit and veg is. So generally, we just try and encourage people to have a cupped handful. That would be a portion. So it's extremely easy to overeat things like grapes or raspberries or blueberries because they're so small. So a cupped handful is what we would generally class as a portion. 3 heaped tablespoons of vegetables, which again is about a cupped handful, and a small bowl of salad. 1 tablespoon of dried fruit, because obviously the natural fructose within those are very concentrated when they've been dried. And 1 portion, which is 150 ml of any fruit juice, and that's not from concentrate, during the day. I've put a QR code in there for the British Heart Foundation Food Portion Guide, which is absolutely brilliant, and we use that very frequently. One of the food groups I did want to talk about was iron. So as you will probably know, the iron requirements for an average pregnancy is about 1,000 milligrams, which is significantly higher than the general population. And it's really concentrated in the last 2 trimesters of pregnancy. So those extra needs will come in as the baby grows and develops. Most people should be able to get all of the iron that they need by eating a healthy, balanced diet, but for some patients and service users, they may need to look at a supplement. We also talk about the bioavailability of the iron that's in foods. So sources such as red meat are supreme because the iron that's actually eaten, the majority of it is absorbed rather than not as absorbed like other sources. So that means it's highly bioavailable. Also to encourage food and drinks that are rich in vitamin C, because iron and vitamin C work together in terms of absorption. And obviously to avoid liver and liver products as they have too much vitamin A. And also to avoid tea and coffee at meal times because they can reduce the absorption of iron. Vitamin D, you've probably all seen the vitamins, the Healthy Start vitamins here. And that is basically, it is really difficult to get vitamin D from foods. So it's better to supplement to make sure that that pregnant woman is covered in terms of vitamin D. Fluid, caffeine and alcohol. So we say about 8 to 10 glasses of fluid a day. That can be higher if somebody exercises and sweats. Caffeine, no more than 200 milligrams a day. So as you can see there, for some people that could be, much less than they usually have, especially if they have a few coffees or teas during the day, or hot chocolate. So be very aware of caffeine intake, and then obviously to avoid alcohol. So if somebody asks, should I be weighing my food? Do I need to weigh my portions? I generally say not at all. Try and think of your plate in 3 sections. So at a meal time, mainly lunch and evening meal, we don't have to have veg for breakfast. We would encourage a pregnant woman to have half of their plate as vegetables or salad, then the other quarter as starchy carbs, whole grains as preference, and then the other quarter as protein foods. So we don't tend to say, you need to weigh out your food. I put some resources in the slide here because it's really difficult sometimes to think about what to have for breakfast, lunch and dinner every day. It's the bane of adult life, isn't it? What are we having for dinner every evening? That are also, nutritious and don't cost the earth to cook. So we've got the recipe book from Nutrition Skills for Life. I don't know if any of you have done the qualification in nutrition skills for life, but it's absolutely excellent to enhance people's general knowledge of food and nutrition. And then from Tommy's, there's some dinner, lunch, and breakfast recipe ideas there as well. So just a little word about food safety. So we always say to avoid raw shellfish, raw and undercooked meats, and unpasteurized milk because of salmonella. Also think about hand hygiene and to store raw foods separately and avoid cross-contamination. Listeria, so as you guys know, to avoid soft ripened cheeses like brie, camembert, some goat's cheeses, to avoid pate, and to avoid soft serve ice cream from vans or kiosks. Mercury, so contaminants, so not to eat shark, marlin or swordfish. And vitamin A, so to be very aware if somebody is taking vitamins. So we always ask, you know, do you take any supplements? Because some people may take them for nails or for hair or for skin health, and they could have excess retinol, which is a form of vitamin A. Also to be careful of fish liver oils and liver products. Few kind of suggestions here about dealing with pregnancy symptoms. So nausea, sickness, vomiting. So having small, little and often. So small, bland or dry snacks regularly rather than having to worry about a big meal. Avoid fatty or spicy foods or foods with a strong smell, especially if you're cooking them, then it can put you off before you've even eaten it. And some people say that having foods with ginger in them helps, or sometimes a mint tea, that'll help, peppermint tea, that'll help as well. Food cravings and aversions, so those can be absolutely individual and they can come and go really quickly, as you probably know. To avoid constipation, to really try and focus on fibre. So again, fruits, vegetables, and those whole grain products rather than ultra processed foods. Make sure that there's plenty of fluid, and also activity can help. Heartburn, so avoid spicy foods, large meals, and particularly in the evening when we're going to be lying down afterwards. And milky drinks and foods can help. So some people find that yogurt helps, a glass of milk. Anemia, so again, a healthy balanced diet and including iron-rich foods, but making sure that the bioavailability of the iron is good within that food, and avoid drinking tea during or after main meals. So a word about weight gain during pregnancy. So obviously we know that it's normal and healthy for women to gain some weight during pregnancy. However, as we all know, gaining too much weight can increase health risks for mother and baby. So it's not recommended that people lose weight during pregnancy. So what we encourage is to keep a track on the weight that's actually gained. So the recommended weight gain during pregnancy for a person with a BMI over 30 is about 5 to 9 kilograms. So in the first trimester, it's between 0.5 and 2 kilograms. And then after 12 weeks is about 0.2 kilograms a week. The IOM guidelines here go into a bit more detail about what a woman's starting BMI was. So if they were underweight, total weight gain should be up to 18 kilograms. If they were starting off with a healthy weight, then weight gain up to 16 kilograms. Overweight, so BMI 25 to just under 30, is up to 11.5 kilograms. And then if somebody is experiencing obesity, so BMI over 30, up to 9 kilograms weight gain, and obviously different for twins. So just a bit about the research behind the outcomes of healthy eating, nutrition, and physical activity in pregnancy. So these are the two kind of biggest studies that we're aware of and we use in our practice. So the IWIP meta-analysis. So this was pooled data from 36 randomized controlled trials, so over 12,000 women. So it found that interventions combining diet and physical activity led to modest but statistically significant reduction in gestational weight gain, so about 0.7 kilograms. It also reduced the odds of cesarean, but didn't significantly affect neonatal outcomes like birth weight or NICU admissions. The Upbeat trial was a UK trial, and this was specifically focused on obese pregnant women. So this included 1,500 participants and tested a complex behaviour intervention. So the results showed improvement in diet quality, including lower glycemic load and saturated fat intake, increased physical activity, and the intervention had the greatest effect in women with a BMI over 40, so reducing gestational weight by nearly 2 kilograms compared to standard care. So whistle-stop tour, but it does highlight the importance of talking about healthy eating and physical activity with pregnant women. So you've probably seen this resource. This is what we use from the Chief Medical Officer. So throughout pregnancy, to aim for at least 150 minutes of moderate intensity activity. So obviously it's important to take into consideration a woman's baseline. So if they were extremely inactive, that would be different advice to somebody who was quite active before pregnancy. And trying to obviously avoid activities that risk being hit. So the 3 A's, which is a really good framework for bringing up weight, healthy eating, exercise during pregnancy, and this isn't just for pregnant women. The 3 A's is, how we train primary care, GPs, practice nurses. So is ask, advise, and act. So we need to ask permission to take somebody's weight, we know that, and we need to ask if it's okay to talk about nutrition, eating, how you cook at home, do you have regular meals, and physical activity. Then we advise, so we give information about the benefits of those behaviour changes, key messages about eating well, making smart goals, so thinking about what's achievable for that person, because we cannot change everything in a day. Behavior change takes time. And then act, so really using our motivational interviewing skills to be able to activate a person to make those behavior changes, know what kind of local services are available or national resources to signpost and support those behavior changes. So some barriers I thought was worth kind of talking through. So physical symptoms may be a barrier. Knowledge gaps, so limited understanding of dietary and activity guidelines. Inconsistent advice, so this is a massive kind of burden, isn't it, with influencers, with social media, but even from healthcare professional to healthcare professional, depending on how up to date they are with their knowledge. So social stigma is huge, and I know we were talking about social stigma earlier with food poverty, but absolutely around weight. So 63% of adults in Wales are experiencing overweight or obesity. So the majority of women will have overweight. And actually, they've probably experienced a lot of stigma and bias around their weight for many years, and within many kind of consultations with healthcare professionals. So really using non-biased language and just a really supportive and compassionate culture. So cultural norms, so the beliefs around eating for two or that it's unsafe to exercise, and low health identity. So some people just don't see themselves as healthy people, and those kind of beliefs can really influence somebody's behavior. But facilitating, so you amazing midwives are empathetic, compassionate, you're non-judgmental, you're absolutely the right people to give advice at a stage in life when somebody is quite activated because of a pregnancy. Digital tools, so the Foodwise in Pregnancy app, I'm going to give you a QR code for that later, it's a brilliant resource. Partner involvement, so encourage shared goals based on individual needs and readiness to change, and thinking about that health identity shift. So not just focusing on weight, but calling it a healthy lifestyle rather than just focusing on one bit. So just a little slide about Healthy Start vitamins. I'm sure you're aware of those. A little plug for the Foodwise in Pregnancy app. So there's an Apple Store code there and a Google Play code. And then some sources of information which are trusted and tried and tested. Those are just here for you to have a look at a different time. So diolch yn fawr. Any questions, and I will be happy to take them.
I think we have the roving mic. There she is, Hilary. So thank you so much. That was really interesting. A real overview of the whole thing and a little deep dive every now and then. Fantastic.
Yeah, I could speak about nutrition and physical activity in pregnancy for a whole day, so it was difficult for me to rein it in.
You did very well. Now, I just wondered if anyone had any questions. We have one right at the back. Please.
Hi, yes, thank you very much. It was really interesting, very informative. What I want to ask you is, what's your opinion about the brewer's diets? There's a lot of, it's by a consultant obstetrician who claims that it's been going on for quite a while, about a protein-rich diet to encourage placental function, even claiming that it can actually reduce the risk of preeclampsia to do with the how the villi and the blood, the placenta embeds at that early stage. And even saying that, you know, it nourishes the uterus and everything, and having salt to taste.
Yeah.
I was very curious to ask what a dietitian thinks about that.
So the brewer is the name of the doctor?
Yeah.
Because when you said brewer's diet,
the brewer's diet, you think about beer and things. No, it's an obstetrician. Yeah, he was saying rather than giving women aspirin, you know, the ones who've got the risk factors, we need to focus on the plasma, the blood being able to expand. And I don't really understand all the chemistry of it, but if you look it up on the internet, you'll see it.
Right.
But yes, I was just curious about what your thoughts were on that.
So I'm a scientist, so I'm going to look at scientific validation in which there is 0%. So there's no scientific evidence to support the brewer's diet. All of the claims that Dr. Brewer makes are observational within his own practice. As far as I'm concerned, it's not something that I would advocate because of the lack of evidence. Whereas we know there's so much evidence about, having a balanced diet, whole grains, and diets rich in fruits and vegetables to reduce the risk of preeclampsia. High protein, sure, we know that the majority of women don't get enough protein in the diet. So making sure that there's a protein source at every meal is always a good idea, but personally would not advocate.
I guess because that's focusing on the entirety rather than one excluding other food groups, because I guess if you spoke to women and said eat lots of protein, they might just think not bother with the other things that they need to. Yeah, that was a fab question. Never heard of it. Next question. Thank you.
Oh, hi. Thank you so much for the interesting conversation. I have a question. I haven't joined from the beginning, so I might missed it. But what would be your advice for the vegetarian or even vegan women, pregnant women? I believe it's a huge topic as well, but just a general,
absolutely.
quick advice. If they still
So a
would like to.
vegetarian or a vegan diet can be absolutely safe and healthy during pregnancy, but it's got to be well planned. So we know that vegetarian and vegan style diets do or can lack in essential nutrients like iron, vitamin B12, vitamin D, and iodine. So I think a lot of careful planning and preparation to make sure that those key nutrients are replaced by vegetarian and vegan sources is essential. Sometimes supplements are required, and that can be monitored by yourselves. But I think a lot of plant-based sources, what we've got to remember is, and I've put this word out several times, is around bioavailability. So when I was speaking about iron, not all iron containing foods are made equally. So if we think of a non-vegetarian or vegan source of iron, such as meat, red meat, it's, extremely well absorbed and it's extremely high in iron. Whereas a vegetarian or vegan based source of iron is going to be half or even less, and it won't be absorbed as well. So, supportive of people's own dietary choices, but we do need to make sure that it's very well planned and possibly supplemented.
Fantastic. Any more? This is food and drink. Anybody else? Mind you, having said that, we are running to time, Sinead. So thank you so much for answering the questions and being with us this afternoon. I'm going to enjoy my recipe books. And thank you for your part in that. And thank you for this afternoon session. It's really good.
Thank you.